No, it sounds on.
Yeah,
Or
my
probably not
sound's
on.
on now. Right, I nearly had the same
Uh,
cock up as last week. Right, hello everyone. Sorry for the sound problem. Can someone just confirm in the chat if they can hear us this week? Because we had this problem last week, and thankfully I've realised early. So if someone can kindly put in the chat if they can hear us, that would be very good, if you don't mind. Thank you for tuning in, and we really appreciate him for watching previous streams. We need about 15 more followers in about 30 days or so, about a month, to get to our goal of 100 so far. And you can also get us on Instagram. Like, all my details are at the bottom of the screen at the minute. Um, if anyone at all can confirm that you can hear, I would very much appreciate it, because it's saying there's a few of you lurking on here. So don't do lurkers. You're gonna have to comment on here. We get involved in this stream. So, people are shy tonight. Give it 5 and they'll all be telling us all about their bowels. It'll be fine. Right then, so do you want to introduce yourself anyway while we're waiting for some confirmation about the sound?
yeah, so, hey everybody, I'm Siddharth. I'm a medical intern and somebody who also has Crohn's disease. So I'm hoping that I can come across with you guys with my experiences as a Crohn's person and through the medical knowledge that I've also picked up over the years. And
Perfect.
finally, maybe talk about how to effectively treat Crohn's with the medication you're taking, also with some new diet modifications, and trying, or at least looking into and researching about alternative therapy methods, so that we just keep an open mind and a holistic way to kind of target Crohn's and give it a good treatment.
Perfect. So basically, we're just gonna have a little chat, and I'm very impressed because we've actually got a PowerPoint that's all been built, and you've built it so fast as well, because we was only literally talking about this yesterday. So in less than 24 hours, we've had some massive PowerPoint sent my way that I've managed to figure out how to set up to stream. So top points for effort. Um, Obviously, this is just one person's opinion. There is medical advice in there. However, please take this with a pinch of salt. It's up to you what you want to do. So, a bit of a disclaimer that basically, if we told you to walk off a bridge, if you go and walk off a bridge, you've walked off the bridge. So, so this is all just to
That's
help keep
true.
an open mind and give like
Yeah.
opinions, that sort of stuff. But obviously, yeah, you use common knowledge, and what suits one isn't going to suit everyone. And I think most people
No.
who've got IBD can all agree we're so vastly different at times that it's just trial and error with a lot of stuff. Um, so yeah, so if
Yeah,
anyone,
I think.
yeah,
Sorry to
please
interrupt
go
you.
ahead.
I think the end of the day, I'm not trying to ask people to change the way they've been living,
Yeah,
but I think maybe at the end of this stream, if they've just picked up on some ideas and some knowledge that they haven't heard about before,
yeah,
they can probably look into that
yeah,
with the current treatment and the protocols that they've been following now. So as you said it, I'm not asking you guys to do anything drastic. I'm not asking you guys to do anything per se, but these are just my experiences and what I've realized and learned. And that's also the reason why I've sort of showed all of my reports in the slide that you guys will see.
yeah,
And I'm sure a lot of the struggles that I've gone through, I'm sure you've also gone through, Sam, and a lot of the people watching have to. So
perfect.
everything with a
And
pinch of salt, I guess. Yeah.
thank you, Louise, for commenting about you can hear us. So we didn't have the problem we had when you was with us last week. So thank you for tuning in, by the way. Um, so we're also, I just want to also mention that you are staying up for us, because at the minute you're in India and we're in UK time. So if we can all just appreciate the fact that you're staying up late for us, that'd be great. I am going to start to share my screen. So if people can confirm that they can see the slide, that would be great. And basically what we'll do is get started, and I'll just be keeping an eye on the comments rolling in. So yeah, big shout out to everyone joining. We will obviously be going through stuff as we go through. Um, so I'm gonna just get you to ask me to click through as well. Obviously, when you want the, I'm in charge of the PowerPoint, which is never good when I'm in charge of anything. So you're gonna have to tell me when to change the slides on it, and we'll just hope for the best, basically. So, yeah, if you want to get started,
I think
and
we can start. Yeah.
yeah, I'll let you just sort of take charge, and I'll sit and chill for this stream, really.
Okay, so I'll start off with a basic review on the disease itself, what the disease is, who are the people who are probably likely to develop the disease, what are the treatment protocols, the common complications, the symptoms associated with Crohn's, and other sort of modifications that people with Crohn's usually have to do. So first of all, Crohn's disease is part of inflammatory bowel disease, which are of two types, major two types. One is Crohn's disease and the other is ulcerative colitis. So they're usually known as the brother and sister disease. So for Crohn's is also what I have. It's a chronic inflammatory bowel disease which can present itself from the mouth to the anus. Usually for most people, it starts off in the small intestines and at the certain starting area of the large intestines, but usually between the terminal ileum and the ascending colon. So, who are the people who are most likely to develop this disease? So, it usually presents itself at the age of 20 to 29. Speaking for myself, I started getting the earlier symptom of Crohn's back when I was 13 years old. And for my sister, who
Oops.
has ulcerative colitis, she's only developed the proper manifestations around the age of 20. So there is a huge variation. There's not a particular range, I would say, but generally it comes around the early adolescence and ranging towards the late 20s. And also, yeah, it's more common in people who has associated the history of Crohn's, and generally people who smoke a lot of cigarettes. That doesn't necessarily mean that people who smoke cigarettes will get Crohn's or ulcerative colitis, but generally, people who are already predisposed to having any sort of inflammatory bowel disease doesn't really help if you're smoking cigarettes because that's a huge no-no. So it'll trigger your bowels to just go crazy. So we probably skip that. Sam, we'll go to the next slide.
There we go. It'll come up on you guys' screen in a second.
Yeah, so common complications of Crohn's disease. I can definitely tick about 1, 2, 3, 4, 5, 6 of these. I've personally experienced them. I'm sure you guys must have had at least a few of them. Hopefully, I'm not wishing it on you guys, but I think we share an experience there. So, starting off with intestinal obstructions. Since Crohn's is a transmural disease, tends to affect all the layers of the bowel. Usually, what happens is in the layer of your muscularis, which is also the layer of the muscle, there is hypertrophy. So, hypertrophy is basically the increase in the cell size, which causes the muscles to increase in the size, which is also called as bowel thickening. So, when that bowel thickening occurs, the peristalsis in that region is not a part of the other regions. So, generally, whatever passage is going through it tends to slow down, and for people with a huge severity, the longer the portion, the more there's going to be the blockage. So that is the intestinal obstruction. And fistulas, that's the huge part which kind of designates Crohn's disease. Since it's transmural, passes through all of the layers of the intestines, fistulas are very common. So it starts off, let's say, in the submucosa, which is the innermost layer, burrows into the mucosa, then goes to the muscularis, and then creates a pathway to whichever region it's opening to. For me personally, I've had fistulas opening into the rectal region or from the rectal region to the perineal region. But in our college, we've also seen cases of people having fistulas. For men, it can also open into the scrotal cavity and have abscesses there, which can spill into the testis, which is super painful. And for
Same thing.
women,
Oh,
oh yeah,
yeah, yeah.
and And for women, it can open into the pelvic cavity. So it can obstruct some part of your reproductive organs also. The problem is there's not any sort of prediction to where it's going to open, but definitely there's a good correlation to how active your disease is, how high your CRP is. The correlation of, yeah, there is going to be a development of a fistula tract or any of these other complications. So abscesses. Abscesses can be a correlation with the fistulas or can be a standalone complication in itself. Usually, people who have a fistula in ano, which is around the anus region, generally tend to have abscesses also because the fecal matter tends to get deposited in one of these fistula canals, which get burrowed through the end. And since the fecal matter actually has no drainage or no place to go, tends to get infected. And once it gets infected, you start having pus, and the pus starts swelling up, and it's just horrible, very painful stuff, and especially if it's around the perineal region. The perineal fat is tightly wound, so there is not a lot of space between each of the fat capsules for the place to sort of compress. So the second you have an abscess in that region, it's just horrible amount of pain. And also it kind of is not really helpful that there's a lot of nerve endings, which help pick up all of the painful receptions and all the struggle passing to the loo every time. So that's not fun either. And anal fissures are common because sometimes we do tend to get constipated. We do tend to strain ourselves in the restroom. I would honestly say this is to anybody, if you're having IBD or not, when you're not are not able to pass your stools freely, it's always better to hydrate yourself better and try later rather than trying to go all out in the restroom and just sort of hurt yourself in the process, because those are the ways you're going to develop anal fissures, hemorrhoids, pop a vessel over there, or increase your chances of rectal bleeding. So these are the things you can try to avoid to just keep these complications at least a little bit. Ulcers. Ulcers, again, can happen throughout your digestive system for at least people who are having Crohn's. If your severity of the disease is really high, Crohn's can migrate from your initial diagnosis point to any other region. So these can be some signs for you to pick up on. Let's say if you have a non-healing ulcer in your oral cavity, even though you've put your creams and you've put some anesthetic agent, not really getting a good enough response, it could possibly be that your Crohn's is acting up and it's migrated to another part of your body.
Can
And ulcers also, I'm sure if you guys have gotten any of your colonoscopy reports, I'm sure at different regions of your, GIP, you must have noted there are ulcers. And these are usually of the aphthous type. So they do have some sort of secretions on it, which um, usually don't go away when you scrape it. And again, one of the very sad but real complications of Crohn's is malnutrition, since it is taking place, at least for the most part, initially in the small intestines. And the small intestines are where most of the nutrients get absorbed. When you have such inflammation and all sort of ulcers, there is only so much your body can take away from this. So people tend to lose weight, people tend to have reduced appetite, and for severe complications, people tend to have vitamin deficiencies, mostly in the water-soluble vitamins, since those aren't the vitamins that are stored in your body for the long periods of time. So example is the B complex. Vitamin B12 is usually at the low for most people. At least I can definitely say so for myself that my vitamin B12 levels aren't the best. And that also correlates to your laboratory finding, to your blood tests. When you do your blood tests, I'm sure many of us have anemia. It's also part of malnutrition. But your anemia could not only be because of your loss of iron or decreased iron absorption, but can also be because of decreased vitamin B12 absorption, which is very important in the synthesizing of the WBCs. So when your RBCs are being produced, you need vitamin B12 and vitamin B6. So usually people who have, malnutrition with Crohn's don't tend to have great amounts there and tend to have either microcytic hyperchromic, which is seen in reduced iron deficiency anemia, but can also have megaloblastic anemia, which is due to severe vitamin B12 deficiency. So if you guys are getting your blood tests done, probably look into these factors also. And yeah, inflammation. Inflammations, your joints, your soft tissue, your eyes, skin, and if you maybe notice that some, like a certain day your eyes are really dry and you're having some sort of redness on your nasal side of your eye, it could be because of your Crohn's also. Could be because maybe you're not blinking enough, you're just staring at your screen for too long. Probably to all the gamers over there who just, go into the game full-fledged, forget the 20-20-20 rule. Sam, I think you should also follow this. It's super easy. Uh,
My mates are like, I always complain because when I have a flare, my eye
yeah,
sockets go very grey. And I'll constantly be going to all my guy mates, like, oh God, do my eyes look really bad? Do they look really bad? And like, half the time, Sam, it's because you've gone through lockdown staying up till like 2 in the morning gaming as well. So you're
true,
really not
true,
helping
true.
yourself.
Yeah, absolutely true. And I think my gastro tells this to me all the time also. Whenever something happens to me, right, or whenever something happens to us, we always think, it's the Crohn's. My
Yeah,
Crohn's is
it must
acting
be
up
my
again.
Crohn's. Speaking of going, it must be my Crohn's. I've got a question about the ulcers. So,
Yeah.
when I had my colonoscopy done, they found a single ulcer in my large intestine, and then when I had the pill cam, they found quite a few little ones in my small. So, like when you said before about a common type of Crohn's is I can never pronounce it, but where the small and the large meet. That's technically where mine is.
Yeah,
I
the
yeah, yeah,
ileocecal valve.
yeah. So I've not long finished steroids, and they're trying to keep me treatment free for as long as possible. I'm assuming because of COVID, that's makes it more of a risk.
Yeah,
But
yeah, yeah.
I've started getting a new pain in my stomach the last few days. On the whole, fine with the toilet, sort of. Ish, she says. But I've been getting a new pain, and I've noticed I've got two ulcers in my mouth, and I haven't had mouth
Ooh.
ulcers for a while. Is that something I should be now going to the doctor, or should I just be waiting to see what happens? So I don't know if
No,
that's classed
no,
as still a
I think
flare or not. I don't know.
no. I think that's a good point.
Yeah,
I think you should correlate your
yeah,
mouth ulcers to the other symptoms you're facing too
yeah.
also. And
Okay.
I mean, how long has it been since you finished your steroid therapy?
Not very long. Probably about a month, maybe a little bit longer.
Yeah. So
And
since it is,
yeah,
yeah, please go ahead.
and I've noticed, although I've been a little bit more ambitious trying new foods because I was on safe foods for so long because my diagnosis took like over 5 years because they kept telling me it was IBS because it obviously being mild, I guess it makes it a lot harder to detect. But I've noticed I'm struggling to eat bigger meals again, so I'm not sure if that's not a good sign either. So
I
I don't
mean,
know if you can
it,
shed any
it,
light on it.
no, I think, see, since you have just finished your treatment,
Yeah.
um, is the treatment eventful or not? I think, have you gotten any of your blood parameters checked for
They've
normal
took my
prognosis?
blood, but they haven't got back to me, so I assume that means it's fine. However, I must admit my hospital
Hmm.
isn't the best at getting back to you. It took them 11 months to get an MRI back to me,
Oh man,
which
that's
doesn't fill me
really
with faith.
what the heck,
Yeah,
crazy. Wow. No, I definitely think you should get this looked into
checked. Okay, cool.
since you are having difficulty following your normal diet.
Okay, cool.
See, one of the main things with Crohn's is you have to be very certain to pick up the signs as soon as possible. The
Yeah,
longer we wait, the more it's just going to get worse.
yeah, I'm a bit of a pain for that. So, right. I've
But
changed your screen for you as well now, by the way. I
oh
just wanted
yeah,
to ask that question out of curiosity while
no,
I was on
no,
the
no, no,
subject.
I think. No, I personally think if you had your blood parameters to
Yeah,
sort of give more light into the situation,
yeah.
if
Okay, cool.
if your CRP, I'm sure is one of the factors your doctors must be looking into, right?
Yeah.
You should correlate with your CRP, and
Okay.
if you're having not the best bowel movements also, I
Yeah.
think you should definitely get it looked into. And if it's not healing, how long has it been, if I may ask?
So
The,
because I'm newly diagnosed, I don't really know what to expect in terms of what remission is, I guess. So I'm I get a lot more energy now than I
hmm,
used to feel like death all of the time, not gonna lie.
yeah, yeah.
And a good day for me is still going at least 3 times a day.
Oh
And
wow.
anything from six. I think before I started steroids, it was about 6 times a day, and at my most severe, I could go about 14 times a day, even if I didn't
Oh, wow.
eat. And I could have a
Mm-hmm.
glass of water, and without being vulgar, if I had the glass of water, it would just come out of
Yeah,
my backside like it went in. So I'd always just poo clear water with.
yeah.
So if I'm honest, I mean, you guys, especially people who sat in the chat as well, you guys might be asking me more advice. I don't know if 3 times a day is still normal or not. Don't really know.
I mean, I think normal, the normal amount of bowel movements for somebody who has IBD is very relative, I
Yeah,
would say.
yeah,
Compared to 14 times, I would say 3 is
a win.
definitely better.
Weirdly, when I was a child, I used to only probably go once or twice a week, and that was it.
Oh
So,
wow.
so it's very strange how I went from a kid rarely ever going to going obviously all the time now. Um, so yeah, but sometimes even now, like I can still go 4 or 5, 6 times max a day. Oh, it depends on the day. Some days are better. When I get stressed, I'm more likely to go more. So I
True.
do think within reason, I do have a little bit of IBS still going on as well in the background. Maybe I don't
Mm-mm.
know. Just
No, but
speculating.
you've made a good point when it comes to stress.
Yeah,
Stress is
I'm
a,
terrible for it.
oh, we have to control our stress as much as possible. I mean, if I can share this,
Yeah,
in medical school, you have vivas, which are basically vocal examinations, and sometimes they really grill you. They just start getting almost to a point of abusive
yeah,
sort of humiliation, and it's
yeah,
hard, when you're trying to keep your mind at ease, but you also have to control your stomach because the second
yeah,
it starts becoming a little bit too much, your stomach just starts to like churn and just kind of
yeah.
squeeze up on itself. But end of the day, we have to manage with our stress because we can't run away from all the stresses we get in our daily lives. It's not
Mm.
possible. But as
Uh,
much as we can, I think we should do our best to try to keep it in a decent amount of control.
yeah. Going back to the slideshow, obviously, I'm assuming a lot of people at home have already sort of read the kind
Yeah,
of
yeah, yeah,
symptoms
yeah.
and stuff
I
like
think
that.
yeah, I think what I want to talk more about in this
Yeah,
slide
yeah,
um, is the autoimmune reaction, which is something new.
okay,
We've known that it could be, I mean, the exact cause is not really certain, but from what we've learned so far, it looks like it could be a, like a series of different things which could actually sort of cause Crohn's. Whereas the autoimmune reactions is something new. And I used to think that this was kind of the reason why I had Crohn's,
yeah,
because back in like 2010, I put my head, the whole head into this pot of water, which was probably growing bacteria for a year.
yeah,
And the second I did that, I immediately had pneumonia. And I guessed probably a group of bacterium sort of migrated there from my intestines, which is also the Mycobacterium bacilli group. So I used to think this was one of the reasons why I had it until my sister develop ulcerative colitis, which I guess can't happen through the mycobacterium medium paratuberculosis, but definitely we should sort of find the etiology so that the treatment modality would be better. But okay, Sam, can you change to the next
Yeah.
slide?
It'll just give it a few seconds. People who are in the comments who just saw that last slide, how many of you would say you experience most of those main symptoms on there? If you want to drop that in, that'd be quite interesting to see how many of us have quite. I think most people have most of those. When I asked on Insta about the skin and joint problems, about 80% was having skin problems. There was less having joint problems actually, but skin was quite a big one actually. Um, right, do you want to carry on reading with that then? Sorry, I just wanted to put that comment in there if people can comment on their
No,
symptoms.
no, it's good to keep it interactive. Okay, so diagnosis. So diagnosis usually starts after the person starts really feeling the effects of Crohn's. If I could take my own case into example, I only went to the doctor after I started going to the loo maybe 6 times a day when I started having blood in stools and I started seriously going to malnourishment. So usually many people who have Crohn's tend to miss out the early diagnosis. But luckily for me, since my family, we run a business of diagnostic centers,
Yeah,
I was able to sort of have that immediate medical attention whenever I needed. So relatively for me, from the onset of my symptoms, I would say we sort of figured it was Crohn's probably a year and a
yeah,
half from the onset,
yeah,
which I still think compared to what most people find out from is pretty early. Do you agree
yeah.
with that?
Yeah, mine took forever, and I think a few of the people who are probably on the chat, when I've tried to do a little bit of a Q&A on Insta a few times just to get a gauge on people because obviously everyone's so different, but most people have come up saying, unfortunately, there's a lot of IBS
Yeah,
neglect
yeah.
going on, unfortunately, I think for a lot of people.
Absolutely. And in India, since it's not really one of the most prominent
Yeah,
diseases,
yeah,
people usually get diagnosed very late because first they start treating them as a diarrheal disease or an infective pathology
yeah.
because that also is quite rampant from all the street food, God knows from which hands have come out from. So usually they usually start the antibiotics, but that only gives them relief barely, and people come up with way past the point where if you pick it up early, it's good to start treating early. But
Yeah,
when
yeah,
you pick it up when you have throughout the intestines, and you're just sort of having your rectum peeking out every time you're going to the loo, it's
yeah.
kind of
Not
hard.
normal. No, not good.
So most of you guys should have gone through this also. Physical exams, they would have checked. Obviously, there are days where you're puffed up like a balloon, so they have to check your abdomen for bloating. They use a stethoscope to check your abdominal sounds, to check your peristaltic sounds, taps on the abdomen, which we call percussion, and auscultation to check whether there's any enlargement of any of your organs, usually splenomegaly or hepatomegaly. And through the physical tests, you just kind of get a broad understanding, and then you go through your more thorough diagnostic tests, your lab tests, which include your blood and stool, both of them very important to keep a track of. I personally get my blood tests done during a flare every month,
Yeah,
so I can see the progress of my disease.
yeah,
The usual factors that I go for are my complete blood picture, ESR, and CRP, which is C-reactive protein.
yeah,
Um, these parameters alter a lot based on your flare. So generally, let's say if a person's having a pretty severe flare, tends to have lower amount of hemoglobin
yeah,
since there's decreased absorption of iron. Along with that, people tend to have higher eosinophilic counts because of any secondary infection. And your CRP is an acute phase reactant secreted from your liver, which indicates any sort of inflammation in your body. Your CRP goes high. So when your Crohn's is starting to act up a lot, your CRP goes high. The same prognostic factor could be said for ESR, which is erythrocyte segmentation rate, which is basically the Rolex formation of your RBCs. Again, they get worse as your disease starts progressing, it gets more severe. Uh, Intestinal endoscopies. So these can be from either ends. You can have your endoscope go through your oral cavities, through your stomach, check your esophagus, your abdomen, I mean your stomach, and your initial parts of the small intestines, including the duodenum and the jejunum, and barely touching the ileum. And then you have the colonoscopy and sigmoidoscopy to check your large intestines and a pretty decent amount of your small intestines. And again, your endoscopies can vary depending on the instrument used. We also have capsule endoscopes for people who have maybe difficulties or any other sort of complications for the rectal cameras or oral cameras. And you have CT scans, which can be with contrast or without contrast. Have you gotten any of the contrast CT scans done?
I had MRI done originally back in 2015, and ironically, that was what took 11 months to come back. And now that I'm registered for my online doctors, I can actually see the paperwork that got sent to my doctor. And in it says something. I'll send it you later because you might know what it means, but it says it's normal, but there's something there, but I don't understand the terminology. And then someone in Biro has gone and wrote Crohn's question mark, and then
Mm,
sent it back to my doctor and said everything's fine. And nothing ever got chased. They wanted me to see a dietitian for IBS, and then basically it all got revisited. I think November 2019, and I hadn't gone for over 2.5 years. And when I last went, they said I was not about 9.5. At my heaviest, I was 11.6 because I had heart surgery, and I was struggling to like do anything, so I got quite big. But I'd always sat around 9.5, 10.5, depending on whether I was being good and eating well and going to the gym, or whether I was being lazy. But I'd never usually have gone past 10.5. And even with mega dieting and going to the gym, I could never get past 8 stone 6. 8 stone 6 was always my limit, could never get past it. And now, when I finally went back in, I went in thinking I might have a chest infection, and they flagged up loads of other problems with my weight instead. And at the time, I was 7 stone 8, which was 2 off being underweight for my BMI. And
mm,
now I'm about 8'6", and I struggle to get any heavier. So it's really strange because before I couldn't get any lighter. Now it seems
yeah,
like I
yeah,
can't get any heavier.
yeah.
So yeah, so and then they did endoscopy, colonoscopy, and then eventually I had pill cam, which detected the stuff that was in my small intestine.
Mm, mm, mm.
So yeah, so that I had a bit of everything in the end, basically. Um, in fact,
I
my
think.
test cameras never come out. It ended up
Oh man.
dissolving.
Oh man.
So then, as I swallowed the real one, she was like, "Oh, yeah, it probably is Crohn's because if there's like inflammation, it's slower to go through." And I'm like, "I've literally
Sure.
just swallowed the real one, and you told me it's surgery to get it out. So thanks. I'm
Oh
really gonna
man.
enjoy that
Oh man.
now."
Did they have to open you up to get the camera out or?
No, because thankfully the practice one dissolved and the
Ooh.
real one thankfully come out. She said just try and eat mainly like liquid soft food to make sure it doesn't get stuck or anything. Um,
Mm,
and then I only went in and met my IBD team for like the first time about 3.5 weeks ago or so, and he did show me the photos, and there's like lots of tiny little ulcers in my small one,
yeah.
but not that bad compared to like, I mean, I saw some of your photos that you're going to show people in a bit, and I was like,
Yeah.
yeah, my heart go. Anyone who's got mild, it's painful. So I don't know what even moderate, let alone severe, go through. So anyone who's watching who's got IBD right now, fair play to you, because I think people don't actually estimate how much pain we can operate on, honestly. Like, especially people who've got a lot more inflammation. Honestly, if you get up and you go about your day and if you're working and all sorts, honestly, you're like fucking superheroes. Like, so if ever you're feeling shit, please remember that other people are going through it, understand, and honestly, like, yeah, I think people take for granted how hard we actually fight just to go about a normal day. Um, I don't know if you want to obviously carry on. Do you want me to change the slide? I'm rambling. I'll change the slide ready.
I think you can change the slide.
Yeah,
No, but
it
I,
should
I've
pop up
just
in a sec.
no, I've just agreed to like every single thing you've said because honestly, I've had some bad days, but Crohn's can get pretty nasty, and
Yeah,
people are very strong and
yeah,
they overcome it and they stand strong, and it's just inspiring, honestly, because even checking out some of your streams and
yeah,
following Crohn's and Colitis Foundation,
yeah.
there are some real superheroes out there.
There really
Like,
is. There is so many. Like, all I feel like I do is just put myself on a stream and just chat away. Like, there's people climbing Mount Everest, and I'm just here like doing something I enjoy doing and chatting away. So I really don't think anything of it, but I just like the fact that people are willing to come and share their stories, because I've only sort of been in the community for a very short period of time, and I know it sounds weird because no one would wish this illness on anyone because it's just fucking horrible, but I'm so glad that people are the most supportive community I've ever actually come across with anything. And they'll happily tell you absolutely, like, tonight, no hesitation. This is how many times I go to the toilet. This is how many times I go to the toilet. And
yeah,
people are so open. And I feel like we need to be like this in society, not just on a stream. Like, this sort of
yeah,
stuff should be so normalised, it's untrue, because people ignore symptoms because they think it'll go away. Like James last week, he'll openly admit he ignored his problems, especially without sounding harsh, I think more so in guys. And I really don't feel like we should be embarrassed or anything, because at the end of the day, it's part of life. We can't help it. It's an illness. Like, people are going, like, talk about other health issues, so you wouldn't be embarrassed to tell someone you've got a cold, so why are we embarrassed
yeah.
about this?
No, I think I think it's a problem with the social stigma when
Yeah,
it comes
yeah,
to talking about the loo. Most people aren't really that open about it, but I guess the longer you have this problem, the more you just don't give a shit about it because
yeah.
literally you just you're going through it all the time.
Yeah,
So
you get used to it very quick.
you just okay. So I'll talk some about
Yeah,
the normal treatment protocol. I'm sure most of us have gone through. So generally, the treatment protocol for inflammatory bowel disease
yeah,
is labeled as step ladder protocol. So you initially, as you can see the pyramid here, you initially start off with your 5 amino salicylic acid
yeah,
compounds, which include your mesalamine, your sulfosalazines, which um, work on your oxycyclase pathways and your prostaglandin pathways and reduce your inflammation through that. And people are also prescribed antibiotics because generally, initially, when you have your symptoms, since there's so much wounds, right, with your ulcers open, your inflammation, there are a lot of leaky gut areas where the bacteria can settle in, cause an infection to that also. So antibiotics help first nullify the infective cause, and then your salamines help on your inflammatory effect. Usually, they start off this treatment and check your prognosis on it. If you respond well to it, you can sort of um, stick to it throughout your life. As my gastro calls it, the bread and butter. You have it every day. But if people who don't respond well enough, they start off on your other adjuvant therapy, which is steroids. And steroids can range from topical steroids and systemic steroids. So I've always taken topical steroids, which is budesonide, sustained release capsules. So luckily, I haven't really experienced much of the side effects from the proper steroid usage. But again, people who are taking corticosterone or hydrocortisone, they usually have more of the side effects, including higher glucose levels, higher blood pressure, increased weight gain. And one thing everybody should listen, like for sure, like keep this in mind. If you're on any sort of steroids, don't just stop the steroid therapy on a whim. You have to taper down your medication. If your doctor started you on 6 milligrams, he would have told you after a month you go to 6 milligrams, and then after a month you go on 3 milligrams, and then you taper it down. Because if you stop your medication at a high dosage or any dosage, your steroids suppress your adrenal glands, and your adrenal glands are responsible to produce your natural corticosteroids in your body.
Can I
When you
interrupt you on
suddenly,
that one? I was
yeah,
on 6 milligram for eight
okay,
weeks, consistent, and then they told me to come off.
no, that's not good. That's wrong.
And
Yeah,
I've
that's
spoken to a few people who's like, you should have gone down to three. And I'm like, they told
yeah.
me to just do that and then stop. And I had a rash on my feet for 2 weeks after. And I didn't know
Yeah,
if that might be
you're.
connected.
It definitely could be. No, it definitely is because
Okay.
see, your body has to have. It works like this. Your adrenal glands are
Yeah.
producing a certain amount of steroids in a day.
Yeah.
You're giving all of these exogenous steroids. Your endogenous steroids get suppressed. So
Okay.
as you keep taking these steroids, your body's own steroids aren't produced as much. So the idea of tapering down steroids is to give your body the equilibrium to sort of balance out the exogenous steroids and to secrete more.
Yeah.
If you don't do that, see, in your case, luckily it didn't cause an adrenal crisis. Because for
Yeah.
people who are taking very high doses, let's say even more than six
Yeah.
milligrams,
Yeah.
if they stop it like that, you're not giving your body enough time to adapt to it, and then they can lead into an adrenal crisis, which can basically put them into a shock, which is emergency situation and
Wow.
can be fatal also.
Wow.
So when it comes to steroids, tapering down is a must. I was recently prescribed some steroids for my eye since I was having constant redness on my nasal side of the right eye. And even for ophthalmic steroids, the prescription goes like 10 days. You have 4 times a day. And then 1 week after that, you have 2 times a day. So every aspect you taper down your steroids. So definitely that you should ask your doctor.
It
Um,
sounds like I need to change hospital because there's a few things already been said tonight that's making me think, I'm not convinced by this, to be
yeah,
honest.
yeah. I'm just reading the stream.
Yeah.
La Ro, she
Yeah.
points out something damn true. See, her
Yeah.
friend was on 40 milligrams,
Yeah.
and then she stopped. Adrenal insufficiency. That's a very common thing that happens when you don't taper down your steroids.
Yeah, it's quite scary, to be honest, some of the neglect I think that goes on. And I think sometimes it's not just neglect, it's just lack of knowing. Like,
I
I
mean,
didn't even know that was a thing,
yeah.
I
I
guess.
mean, see, end of the day, your doctor should inform you what these medicines are for and how you're supposed to
Yeah.
responsibly let them go.
Yeah.
Because when we don't have the understanding,
No.
people would normally think, I'm feeling better, I'm under the remission, my stools are better, I feel energized, I'm just going to stop my medicines. That
Yeah.
you can never do that. You're not supposed to do that, especially with a chronic disease like Crohn's and ulcerative colitis. Don't stop your medicines without having a proper consultation and
Okay.
tapering down.
Yeah.
And generally, when it comes, these are the points I'll talk about later.
Yeah.
But this is the general protocol I followed for a long time, where
Yeah.
I've taken my mesalamines from what 2013 till 2019, 17 every day. So
Yeah.
this is not something you just leave. And I'll talk about why I left that later on,
Okay.
which I'm not
Okay.
asking you guys to do. It was
Yeah.
just something that I did because of whatever I was experiencing. I'm not asking you guys to stop anything. Please, like, read about it, ask your doctors. Definitely, just I would say, listen to what I've gone through and just sort of read about it yourselves, I would say, because I am a huge nut when it comes to reading about the things before I do something. In medicine, there's a term called second year syndrome. When we're studying pathology and microbiology, we sort of self diagnose every single disease. So I get kind of paranoid and I have to read everything a little bit thoroughly until I kind of, make sure that, okay, this is not what I have. I think we all do that. And we can't leave it to Google either because Google's just going to tell you have cancer. So you can't go Googling everything.
The NHS, I've already said this a few times, the NHS bedside manner when you put Crohn's in is so bad because it's like, these are your figures of living with Crohn's for 10 years and your chance of getting cancer. And it's like, I've just found out I've got Crohn's and now you're telling me I'm going to get cancer in like 5,
Cancer,
like,
I
thanks.
swear. Oh, that,
Like,
yeah,
let
no,
me just deal with the Crohn's, like, diagnosis first before you whack that in my face.
so, don't go Googling. I mean, it's good to read it, but just take everything with a grain of salt, like you said earlier. Because, see, like some guys, right, and it's only natural. Obviously, nobody wants to think about getting cancer,
Yeah,
but you read these things and then you start stressing on it, and then you just get stressed out, and then that kind
yeah.
of
And then go
messes
and have
up
a
your
flare
whole.
up.
Yeah, that
I'm just gonna have a flare
it,
up now. I think I'm getting cancer.
I swear, it's like it's a cycle of unfortunate events, and you need to realize where you're just going to cut it off and just stand there for some time, go on a linear path of this healing. I think that's one part we need to really understand. Is stress is damn important. Can't go stressing about. Super important. Okay, so second, so yeah, your steroids are not working.
Yeah.
You've taken the whole course. The next possible step are your immunomodulators, and most of these medicines are pretty cytotoxic. Cyto meaning cell and toxic is toxic, because most of these drugs work on your DNA um, metabolism and your cell reproduction. So, taking into something like azathioprine, it suppresses the purine synthesis and suppresses the purine activity in the WBC production. So in that aspect, through that pathway, it suppresses the WBCs, which indirectly reduce inflammation because there is a lot of WBC aggregations in the points of where the flood is taking place. But unfortunately, most people with immunomodulators tend to have pretty crappy side effects. Can range from so many horrible things like bone marrow suppression, and also people who are on immunomodulators are very vulnerable to getting other infections, especially during COVID. We have to be a little bit more careful when it comes to taking these medications because we're kind of immunocompromised. Luckily, I would say it's not as horrible as we thought earlier, but still definitely not in as far to somebody who's healthy, and definitely not somebody who's taking azathioprine and cyclosporin, methotrexate. Generally, are more vulnerable to these infections, so we have to be more careful. That's one thing we have to be thoughtful about. Okay, so let's say it's working for you, but something along the lines, your immunomodulators muck up, give you acute pancreatitis, some crap like that, which happened to me. I had acute gastroduodenitis after taking azathioprine for 2 weeks, where I had to be rushed to the hospital because I was just constantly puking and hyperventilating. So since that didn't work out for me, my gastro suggested I go for biological therapy. And this is the one step in my treatment that I haven't done so far. But generally, biological therapies are broken down based on what aspect of the body they're inhibiting. So you have anti-tumor necrosis factors, anti-integrins, anti-interleukins. So each one of these drugs work on that specific receptor or that specific interleukins or integrins. See, interleukins are basically the messengers of the body. When your WBCs aggregate to a point of acute inflammation, chronic inflammation, they secrete something called chemokines. So these chemokines can be of two types. One are cell-based and one are plasma-based. So in cell-based, you have the interleukins. These are secreted by your white blood cells to sort of relay the message of, hey, look, something's wrong here. I'm going to secrete these messengers to aggregate more of these WBCs to come. So the interleukins come under chemokines and cytokines. So generally, the biological therapies try to block off those messengers so that more WBC aggregation doesn't take place. And tumor necrosis factor also works on a similar base, generally chemokines. So you're reducing the inflammation by sort of stopping the messaging pathway. And relatively, it is better than immunomodulators since you're not stopping the production of any of your natural body functions, but just stopping certain pathways very specific to the inflammation. And other medicines, definitely painkillers for people who are undergoing a lot of like severe flares. And not only that, painkillers are usually prescribed to people who have the complications when it comes to Crohn's. People who have fistulas and abscesses. There are very painful stuff, and
Can
you
I
need some.
Sorry, can I just stop you in your track? So, I do apologise. I don't usually look at my phone during a stream because I don't want people to think I'm being rude texting. But I have just had a message come in
Okay.
that when I've looked, it was the reason why the messages didn't come through. Is because it classed it as a rude word coming through, but obviously because we're talking about health, it basically didn't detect it. So, basically, you mentioned ages ago at the very beginning of the stream, I just want to bring this up about testes being affected. Can this person ask what sort of symptoms there might be to suggest like something like that may have happened? I know we've just
Okay.
like cut it off, but if we could just go to that just for this person because I would
Yeah, yeah,
like to
yeah. No,
help,
no, no.
and then we'll carry
So,
back on with where we was
no, no,
at.
no, no. That's a very good point. So, it's not necessarily the testis itself, but it's more of the opening of the fistula tract to the scrotum. So when you have the tract opening into the scrotal cavity, you can have the pus and other infective material swell up the scrotum, and through that can infiltrate your testis. So it's not like the second your fistula tract is going to open into your scrotum, you're going to have your testis jeopardized, but more in the aspects of people not treating it as soon as possible, not going to the doctor and finding out, okay, I have a tract opening there. That is when it can become a problem. But usually you will have a lot of pain, a lot of tenderness around the area, and generally the person who has that would notice that so you have the muscles around the scrotum, they wouldn't probably respond normally to the heat or through other environmental conditions. So for these are some of the signs that you can make sure that okay, something's wrong. So I would say those are the things that he has to look for. But other than that, the fistula openings are mostly restricted to the anus region. Sometimes can open into the internal cavities into the peritoneum. The peritoneum is the abdominal cavity holding all of your, your stomach, your liver, your intestines, all of your GI stuff. So it can open into your peritoneum or scrotal cavity, your pelvic cavity, or the region surrounding your anus. But for the person who it opens into the scrotal cavity, will definitely have early signs where the tenderness and pain and probably even pus discharge can be noticed. So these are the signs that they have to look for.
Thank you. I appreciate that. That was a major help. Sorry to have jumped in. If you can carry on, sorry. I just wanted to make sure that
Yeah,
question
yeah.
was answered for them.
No, no, no. No, if they have, I'm not looking at any of the queries or the side things over here, unfortunately.
It's
But
all right. I am
any,
reading them as I go, and if anything comes through that I think's of note, I am jumping in anyway. So I am on the chat. That's why I keep looking down. So unfortunately, I haven't got a second screen yet. That is something eventually. If the stream's doing well, I'll get a second screen. So at the minute, I'm just giving myself neck out looking down. So if I look like I'm not listening, it's because I'm interacting. But yeah, are you cool with this slide, or do you want your next slide?
yeah, so I have some more points to talk
Yeah,
about if
cool,
it's okay.
perfect.
So yeah, these antibiotics for your infective pathology. Uh, Loperamide, it's usually given for people who are having constant diarrheas, which aren't really, it's not a long-term thing, definitely. Loperamide cannot be taken for more than 2 weeks because that can cause uh, your fecal matter to just get stuck in the bowels and nobody, it can lead to intestinal obstructions and some sort of gangrene can also take place. But generally, loperamide is given to sort of stop the constant diarrheal movements. Probably some people would have heard it on the brand name of Imodin. I've taken this for some time. I've taken this for a week when my symptoms weren't really getting sorted out for. And secondary, the other form of treatment is surgical treatment. Unfortunately, many of us do have some sort of surgeries done, whether it's for the complications of Crohn's or the Crohn's itself in the bowel. So normally people get surgeries for fistulas, for the intestinal obstructions or abscess drainage. I've had it for fistulas and abscess drainage, and both of them, since the region itself is not exposed to a lot of air, the healing is not the fastest, and you have to keep your signs up for any other infections because those areas are exposed to fecal matter. So I have to be careful in that perspective. And again, bowel resections. Unfortunately, bowel resections are common for people with very severe Crohn's, where they can either remove your small intestines or your large intestines, or sometimes both small and large intestines, which is proctocolectomy and ileostomy, where you have to um, basically connect your intestines to the anterior abdominal wall so the fecal matter passes through, and then you have a colostomy bag. Unfortunately, these are some of the treatment protocols, but it's in the worst case scenario. So usually people who are undergoing this, from what I can say is you guys are such warriors, and you guys have such tremendous willpower, and um, I'm so happy that you guys still wake up with the amount of energy and positive thinking, and it's okay. You just keep taking your medicines properly, and you can get the reversal surgery done. But even if that is not a modality of treatment, you guys are seriously amazing. You know how to put out there. And finally, the other form of treatment is diet. And honestly, I really want to stress on everybody who's listening to the stream. Diet is very, very, very important, even for the normal person, but for people who have the IBD and IBS, it's super important. There is a lot of correlation with your gut microflora and your gut biome and how your Crohn's is going to react to it. You can look at the anti-inflammatory diet, which is a proper diet sort of stipulated for people who have Crohn's and ulcerative colitis. And these other two diets I'll talk to you guys more about later. But the Ayurvedic diet modification is what I am currently undergoing. And definitely it sounds super strict. It sounds almost insane, but I can't argue with the results that I've gotten so far. So I'll talk to you guys about that diet modification later. And the third one, the Sattvic diet, and I'll just talk to you guys about it a little. Sattvic is it's a way of life in one of the Hindu mythological teachings. You don't have to be a Hindu to follow the Sattvic diet. I am an atheist. I don't necessarily have to have my religion tell me what to do per se, but this diet is very effective for a lot of autoimmune disorders and a lot of non-communicable diseases. So if anybody is interested there, I will share a few sort of guidelines or whatever where you guys can read about the whole thing and just look into that or add this into your diet also because it's nothing crazy. I'm not asking you guys to like buy some insane stuff. Nothing. It's actually super simple. It's the problem is I would say since it's so simple, it's hard to follow. It's the simple things which tend to kind of have difficulty in sort of incorporating in your life because you kind of think I'm restricting myself a lot, but it does help. And I would say you guys should look into that, and I'll share the details with you, Sam.
Perfect.
First, I would say you should look into it, just give it a reading,
Yeah,
and
will do.
maybe convey your opinions and understandings to the rest of these guys. But for sure, just read about these diets.
Okay,
Okay, we'll go on the next one.
cool. Yeah, it'll just take a couple of minutes to just sort of come through to you guys because of the slight delay.
Yeah, so I'll talk about my journey of diagnosis and treatments and flares and like flares again and flares again and one small tiny part of remission where you're a little bit happy and bam there's another flare. So it's usually it's
I
like
love how
basically
you
how
just
the
snuck
timeline goes
I
for
love how
me.
you just snuck cannabis in there.
Yes, that's that was yeah that was also like a good part of my revelation of this is helping me. Um, but yeah, that there was a solid 3 years which it was doing a good job there. But so basically, I'll like finish it off fast. 2011, you start for me. I started feeling the earliest signs of just being tired and losing my appetites and not having enough energy to like attend classes. All of that started sparking up. 2013 was when I was properly sick. I was thin, my eyes were all gone in, and I was having problem with malabsorption. And that was when my gastro suggested I go get a colonoscopy done. And it's kind of hard being 15, 14-year-old going into the room having things injected in you. And the worst part is the colonoscopy prep. I I
Yeah,
I don't know if you.
it's fucking
Uh,
horrible.
oh my god, the colonoscopy prep. Just thinking about that prep liquid kind of puts this weird taste on my palate because holy shit, that sucks. That's like some horrible crap. And the worst part, from what I know, is those damn flavor packets they give you to add to that stupid solution. It's it's always orange or pineapple, and they both taste like death.
Oh, here
It's
it's
so typical.
lemon. It's lemon. I can't even smell some lemon cleaning products now without getting like
I
PTSD and want to throw up.
I swear, oh, those are the worst. And you just have to take them every half an hour. And after like an hour and a half, it suddenly hits you like, oh, it's time to go to the loo. Then you really start feeling it. God, colonoscopy prep is the worst. But then it kind of works out because then you're introduced with some propofol and some midazolam, and then you're just happily just chilling out and dozing off and just poof, you're awake and it kind of sorts off with the pain. And usually the gastro who does the colonoscopy asks me, "Do you like to drink beer?" I'm like, "Yeah." He's like, "Wait until you try this." I'm like, "Okay." All right, let me see how that goes. So they're a little bit cheeky about it also. But yeah, so 2013 was pretty shit because I got my diagnosis, I got the biopsy done. I found out I had intestinal tuberculosis. I had to get treatment for that crap. And again, my Crohn's is kind of flared up. I had a fistula, which was freaking horrible because the person who I went to wasn't educated or knowledgeable enough to know how to freaking deal with an incision and drainage of the abscess. He had no local anesthesia, nothing. He just took a scalpel, sliced up the region right next to my
Oh.
the anus region, and I was just screaming on top of my voice in such horrifying pain. And then he sticks in some hydroxy peroxide, and that shit burns in that gouged wound. And he didn't even bother closing it. And that thing later developed to a fistula, and I had to get that thing operated.
Oh.
2013 wasn't fun. That was it was a pretty serious year for Crohn's. But that's until 2020 comes along, and 2020 was a real bitch also. But that's like 7 years afterwards.
Yeah.
2014, pretty chill. The only thing that was really bothering me was anal fissures, which is mildly inconvenient when you're having Crohn's disease, I would say, at least for me. 2015 was fine. Same stuff, flare, small remission, got a reevaluation, probably added some steroids, probably increased the dosage of my steroids. I'm sure later on in the slides it's going to be something of that fashion. 2016 was again bad. This was the worst flare I had so far since my CRP levels, which were normally around 24 mg per liter at max, went to 32. And it just immediately correlated with fistulas and fissures and blood and stools and a lot of pain and all sort of that. And
Oh, we've lost some of your sound a little bit.
sorry, my cat is also
just in a guest appearance. Oh. Who doesn't love a bit of a cat on a stream?
yeah, he I think he likes to stream a lot also. He's always up on my classes.
He's probably
So
seen the kitty ears, and then I think everyone's like, stop talking about IBD. Let's just talk about cats now.
I think you guys can see him. Yeah, he's just chilling on the side. Yep. So back to the shitty IBD topic. So yeah, 16 was pretty horrible, and 2016 ending is when I joined college, and that's where I sort of discovered the beautiful plant of cannabis, which sort of really sort of vibed into my almost stoner vibe at a point where I was really feeling the herb, and it gave me mad relief. Like it gave me because one of the things about cannabis is it kind of causes constipation. But when you're always having diarrhea, when
It's
you're
not a bad
constipated,
thing. And
it's
you
kind
get
of
the
balanced out.
munchies as well, so all your health issues when you don't want to eat have just dissolved away.
Absolutely. You're like, I'll think about this tomorrow morning when I have to pay for it. But luckily, I didn't actually have to pay for it. Somehow, it just kind of worked out for me, and that kind of went really good till November of 2019 because I had these super important exams coming up, and obviously I couldn't smoke up and study. I had to properly go full in depth with my education at that point. And as I did that, I should have started my normal treatment, but I didn't. I don't know why. It was just pure negligence and stupidity. And then 3, 4 months after, I just started feeling it again. And the worst part was I wasn't able to pinpoint, oh, it's because of my Crohn's. I'm feeling like this. I just started feeling tired all the time. I was drained out, sleepy, just hell on the toilet. And suddenly there was a day where I felt this sharp pain close to my anal region, and I freaking knew it. It was too late. I knew it. I just dragged it too long and had to go to the doctor and get all of my stuff done. And there was a nice fistula tract, a nice abscess. CRP was 36, 32, and all of my parameters were just out of the charts. Just the worst. And unfortunately, that was the same year because I kept going to the hospital constantly. COVID-19, I picked up the damn COVID virus and had to. Oh no, this was before I got admitted to the emergency room because I started azathioprine since my um, amisalamine and my budesonide weren't working. I started my azathioprine for a week and a half, and that just triggered acute gastroduodenitis, and I had to be rushed to the hospital with constant, uncontrollable vomiting. And honestly, I was so scared, not because I was vomiting, but the problem with gastro, any sort of uncontrollable vomiting, is that you can aspirate the vomitus. And that's when shit can get very bad. And what I mean with that is when you're puking uncontrollably, sometimes certain amount of that vomit can get into your lungs. And when that happens, you can go into severe pneumonia and infective pathology, and that's nobody wants that because treatment for that itself is quite bleak because you have to have a tracheostomy done. I was freaking out because you never know, one thing can lead to a completely other thing, and that's the worst part because you can never really predict the next sort of phase your body might go through. So was rushed into the ER, gave antiemetics, proton pump inhibitors. I stayed there for 6 days, kept going in and out of the CT scan rooms and the MRI rooms. And unfortunately, since it was the pandemic, a lot of people who were having the coronavirus were also sharing those devices. And I told the technician repeatedly, I don't want to take my mask off because you just told me there was a COVID-19 patient who's gotten his lung x ray done just 5 minutes ago, and you're asking me to drink this right here. Why couldn't I have drunk this outside where there was an open air? But he was like, sorry, sir, please drink it here. I had to drink the barium meal for the contrast CT scan, which was completely pointless, made no sense, but whatever, they had to do that crap. I picked up the damn coronavirus, came back home. Luckily, I knew there was something wrong, so I isolated myself. And it luckily wasn't so bad. It was mild, but it hit my stomach and it hit my intestines because until that point, at least till a certain degree, my Crohn's was kind of under control. But since with the correlation of the virus also, I just had insane diarrhea, insane weakness. I just lost all the appetite. I just didn't feel like eating anything. And I lost the sense of smell, the sense of taste. It just felt like I had random textures in my mouth rather than actual food. And again, I'm not trying to give cannabis like all of the credit here, but I must say I kind of opened up to my family before I got my the whole emergency hospital situation. So we kind of had made, and yeah, I also told them that listen, I don't want to put my lungs under stress. I don't want to have this medicine through inhalation, which is obviously going to give me some sort of diet. So we made some oil, and I used to take that oil at the exact dosage where I didn't feel the highness, but I felt the medical benefit. I felt my stools getting better. I felt the hunger. I could actually eat further. And honestly, during that whole COVID time, it helped me sleep because of the whole body pains. Because cannabis is an analgesic, right? It can help with pain. That really helped me there. But afterwards, it only helped me till a certain point because I would put it in this way when it came to my scenario, where if you're having a flare, it cannot possibly cure your flare. It can't help you go to a remission. It can possibly help maintain a remission with your medication, but I don't think it can help put you into the remission. But it can help with the symptoms. So in that aspect, it did a great job. And so yeah, finally in 2021, this year, I got my last like recent colonoscopy done, and to no surprise, there was super ulcerations, cobblestone appearance, which is characteristic of Crohn's. That you literally, I've read in my textbooks. Um, my ileocecal valve, which you were telling me you also had a problem with in your past flares, completely deformed, and I was suggested to enroll into a clinical trial from this drug I think is called mirikizumab, which I think it's mirikizumab, or there was another one which works on the P factor, which is not even through the interleukins. It's another subgroup of the messengers. But honestly, reading about it, I was a little bit, at least this is my perspective. Again, there are a lot of people who are helped and have great sort of remission through adalimumab, infliximab. They have great response for it. I'm not asking you guys to not take it, but since I wasn't provided with that option, I was provided with a clinical trial, which wasn't really um, therapeutic value, and the adverse effects were not really thought of as much. I didn't want to do that. I just wanted to try something else, and that is where I started my Ayurvedic treatment, which is the SBEBA, which stands for Science-Based Evidence-Based Ayurveda. And I'm so sorry, Sam. I forgot to share you their Facebook page yesterday.
Oh, it's
They
fine, don't
share
worry.
they share a lot of their cases, not only from IBD, just insane, like the stuff they do. And I'm just what I want, or what I would ask you to do, is just to look into it and read, because they're very, very systematic. They follow the scientific method. They follow proper medical modality of treatment, of diagnosis, of what your proper history was, all of your prognostic factors, and then they give you the diet modification with their medicines, which are actually very different. Trust me, like the medicines I'm taking today are one tablet of this thing called Shradharna DS, which I break 8 times and take it every 2 hours. I break one pill 8 times, take it every 2 hours throughout the day. And there's another tablet I break four into four quarters, like quarters, and take that every 2 hours. So that's two tablets. And I'll just show you that sort of thing later on. But it almost seems funny taking one pill, breaking it 8 times, and having it, or taking a tablet, breaking it 4 times, having it every 2 hours. But the reasoning behind that is they want to maintain the steady state concentration without bombarding with the higher dosage of the medicine. So it's different, but it's interesting. I definitely learned a lot from their sort of treatment methods. So yeah, we'll just quickly go through all of the rest of the slides. I think I explained for the most of it. Can you please share? Yeah, yeah.
I'm
So
on it.
yeah,
I'm
this
on
was
it.
so yeah, this was the. You can see the nice cheeks I had in the start of 2011, which sort of disappeared in 2014 with my sad and sunken eyes. You can I think you can see that I'm not really feeling that good here, and I wasn't also. I was quite thin for my age, and definitely for what I ate. I wasn't putting on any weight. We'll go to the next slide.
I like the little bagpipes.
Yeah, this was in the UK, and oh my God, this just I remembered something. So when I was in the UK, I had to use a lot of toilet paper, and I don't know personally toilet paper and my bum didn't work out. It really it like rashed me up like crazy. I was really missing my health faucet and my water jet because that kind of helps you ease that cooling sensation where
Oh,
this
we
was
don't
just
have
a
all that here. It's a bit of like,
oh
if you
oh my
go
God.
out in public, it's like one ply. If you're at home, you got the comfort of like decent ply toilet paper.
I swear it was like I was it was horrible. I was literally oh my God, it was so shitty. And the worst part is since I was like traveling all throughout UK, I was like going, checking out different places in England, Scotland. I can't expect people to have like you said, double, triple plied paper. I'm gonna get the shittiest
Not
paper possible.
Not in public
Sandpaper.
spaces, yeah. In public spaces, see, I've got a toilet phobia, so I can't go in public really anyway. I hate even going for a wee, and most public places, yeah, someone's put about sandpaper. Two people have put sandpaper. Yeah, most of the UK in public restrooms, like right, give them the shit. It doesn't matter. And obviously at home you get good stuff, but even if you were stopping in hotels, it'd have been rubbish to be honest. So, as a country, please don't judge us on public toilet paper.
No, I don't judge you. I'm just I definitely missed what I was comfortable with, and I mean I would honestly say again, I'm sure I've heard because a lot of Indians who go out to a lot of different countries do miss this sort of health faucet, which is actually relatively, if you read about it, is an easy, cleaner way to sort of do your business because
Yeah,
you're not necessarily going through your hand on your bum and
yeah,
the toilet paper can scratch a little bit, and especially
yeah,
for
yeah,
people with IBD, I think enough suffering on that region already.
yeah, yeah.
So that's a maybe somebody in today's thing can try it out. I would say just like sock it into your wash basin or whatever, and just like like jet it a little bit, enjoy the sensation. I mean, try it. I would say before you start shooting shots at it, just try it once. Pretty cool.
I'm with Louise. I keep tissues in my bag as well because I'm paranoid about even having a wee. I like to like I've always, even before COVID, always had hand sanitizer and extra tissue in my car because you don't know where you're going, and God forbid if anything happened and I need a wee, I'm not washing my hands and stuff. So I was one of the few people who've always had hand sanitizer before COVID because I'm an OCD person anyway.
I share this with you. I have a spray that I spray on the like the Western cologne. I just like spray the whole thing. I'm like, okay,
Don't blame
now
you.
I'm good. I'm gonna sit now.
I know a
Okay,
lady who, I don't know if it's a thing in India, but in America they have a lot of toilet seat covers. Um, we don't really have them here, but I know a lady who buys toilet covers off Amazon and always carries them around with her. So if ever she needs to use a put, bearing in mind she doesn't have IBD, she's an elderly
uh,
lady, and she
uh,
always carries toilet covers round with her, and I love it. That's definitely gonna it'd definitely be something I would do.
I
Sorry, carry
mean,
on.
it sort of works in the same principle of the sanitizer and the spray also. Just some, at least like a small layer of separation between
Yeah.
you and that horrible seat.
Yeah.
So yeah, also one more thing I wanted to ask you about.
Yeah.
I mean, even in UK, tuberculosis is still a thing, right? It's not like you guys don't have any tuberculosis cases. It
What was
is
that?
there, right?
Sorry.
Tuberculosis, TB, is it? I mean, it is a little bit still in certain regions an endemic problem, right?
I don't know. Does anyone know? If anyone's in the stream and knows.
I mean, I know for a fact that it's not eradicated in
Yeah.
UK.
Yeah.
So some, but it's definitely way worse in India because that's like one of the worst,
Yeah,
probably infectious diseases you can get, unfortunately, because
yeah,
it's hard to keep a track of the treatment and it's a 6 months treatment. I, so there's a lot of extra preliminary manifestations.
yeah,
So I also had intestinal tuberculosis.
yeah,
So my intestines have definitely taken a whacking and beating and all sort of crap.
yeah,
So if anybody, I mean, definitely I don't think from UK, but
yeah,
maybe any other part of the world, if
yeah,
tuberculosis is still a thing,
yeah.
you should look into intestinal tuberculosis also.
Oh
Could
God,
happen.
you basically making my fear of public toilets worse. I didn't even know this was like really a thing. I'm glad everyone's saying there's barely any cases here. You're making me feel so much better. I have switched the slide as well. I accidentally knocked it. My bad.
So yeah, these are some of the reports that I've had. The first colonoscopy report, you can see the ulcers. We share the IC valve pathology, even me, Sam, with the connection between the ileum and the large
Yeah,
intestine.
yeah,
Mostly that's the part where takes a pretty big beating.
yeah.
The tuberculosis report, the first proper diagnosis on my Crohn's, and
Yeah.
then you can also see my fistula tracks and all of the sufferings on that. We'll go to the next one.
It should just take a few
So yeah,
seconds.
this is just 2014 was chill, just anal fishes, same pentasa, and anesthetic ointments helps that area around a little bit until it sort of heals on its own or heals because your Crohn's is kind of under control. We'll go to the next one.
8 is the same.
2015 was pretty chill. Luckily, the Crohn's was relatively under control because I was under treatment, the same steroids and anti-inflammatories. You can see definitely just looking at the images itself that it's not as bad as the one before, but still not the best because you can see that there is erythema and ulcerations, which is almost always present in our activities in Crohn's. Go to the next one. Yeah, this was the year of suffering. Um, that was a picture of me right before I entered my surgery, which was I remember I couldn't sit on anything because one half of my butt was just so filled with pus that no possible angle was kind of comfortable. It was just pain and just horrible. Was that? And yeah, you can see my CRP is damn high. My post-operative notes of incision and drainage. Memories we have, but unfortunately, part of what we go through also. But it's okay. I guess the only thing is to learn from this so that we don't repeat it. We'll go to the other one.
It'll just take a few seconds. Introduction to cannabis. Just
So,
as a heads up, just to make a comment, just be
yes.
aware that if you do Google it, because I've never done cannabis. I have quite a few skate friends who always try and peer pressure me into at least trying it because they keep saying, "Oh, it helps your appetite and your pain, Sam." Um, it from what I've looked into it, it's quite good, mainly in oil form rather than actually inhaling. But just be aware if you do plan on trying it, it's more of a pain relief and eases symptoms, but it won't help with your Crohn's per se. In the fact that it couldn't actually hide, it almost does the job so well, you might not notice your symptoms are progressing. So if you are considering it, just do your homework on it because we don't want to say either way, yes, go and do it or don't do it. If I'm being 100% honest, I've never done it, but it is definitely something I'm considering at this point because I get a lot of problems with my rib that you might have seen in previous streams, and I think I'd rather take that than keep popping things like tramadol, to be honest. But obviously, if it's something you're considering, go and do your homework. These are just opinions, so yeah, not saying all go out and start getting high and blazed and being a stoner and getting stoned
Another
for
thing
work.
yeah, I know another thing I want to say is, luckily, I think in the UK, medicinal cannabis is okay. You can get just the CBD form, which is not the psychoactive form.
Yeah, they're very
Um,
touchy in the UK though, to be honest. They are very
is it
touchy
really?
about it. Yeah. So one lady actually had to fight for her son, saying that she'd been buying in cannabis oil for her epileptic son, and she had to fight
Mm,
and go through courts and everything, even though she'd got proven track record that it was helping and he was being fit
mm,
free on it, and she still had loads of hassle. Eventually, she did win, and you can get CBD oil, but only max dose is 5%. That's in Holland and Barrett, so it's more like it helps ease like a bit of anxiety and stuff like that. Um, so very much like a herbal sort of, I don't know, like if you went and got a herbal remedy, this is definitely going to do the job a bit better. And we are seeming to embrace like seaweed oil face creams and hemp hand cream, and
yeah,
so
yeah.
there is stuff like that, but it's not like anywhere near as like. To be honest, I think at some point not just the UK, but a lot of countries are going to have to accept the fact they do need to start looking into it more for things like epilepsy and cancer, and quite a few health
No,
issues. If
definitely.
I'm honest, I think eventually they're going to have to it because over here it's still class A. They upgraded it while I
Mm,
was in school to class A, but I don't know how you can class cannabis as class A amongst like heroin and
stupid.
cocaine and like ecstasy.
It's
It's just
stupid.
madness, but yeah,
That is stupid.
it is that case here.
I mean, surprisingly enough, it's not that bad in India.
Okay, cool.
Surprisingly, I mean, if you're going the not so legal way,
Yeah.
you can still get it
Risks.
pretty,
Yeah.
reasonably priced, and you can sort of help yourself through it.
Yeah.
Or you can buy proper licensed CBD oils and
Yeah. Yeah.
tinctures and gummies, sodas, coffees.
Yeah.
Literally, there's so many options.
Yeah.
And surprisingly enough, one of the oils that I am using right now is actually from the UK. Um,
Okay.
it's called Bottled Poetry,
Okay.
and it's nano droplet oils for inflammatory bowel disease. So it's surprising. I mean, obviously, you really don't know how it is from the other side of the perspective, from the other country,
Yeah.
but definitely, I would say in India, it's pretty relatively relaxed
Yeah.
on. That's probably why I was able to continue this for like 3 years without actually getting into trouble.
Yeah.
So yeah, so basically, again, everybody do your research. This is just what I've experienced and what I've um, undergone. So from my perspective and what I've realized was it was really helping me a lot. I was probably already under remission, and me undergoing and consuming cannabis just helped me maintain it a little bit longer, and definitely helped me with all of my symptoms because I wasn't having the constant urge to go to the restroom. And I was definitely partying a lot without having to worry about my stomach just dying or maybe just waking up half dead. And definitely, I could say it allowed me to be a little bit reckless, which I couldn't have possibly been otherwise. But then again, unfortunately, since I do think of cannabis as a medicine, I stopped taking it during November. And since I've done that, and since it's fat soluble, it's usually absorbed in your adipocytes. And when you stop taking a medicine, it is present in your body for some period of time when you chronically consume it. So as the reserve started depleting on its own, I started really feeling it in like Feb, March, because I was basically medicine free without my diet modification, and I just went, the whole thing went to shit. It was just a horrible shit show. Sam, can you go to the next slide?
Yeah, it should come up in a sec.
So yeah, you can see my face just zapped out of all my energy, and I was just just tired, given up, and frustrated because I couldn't eat anything. Like you were saying, if I drank a bottle of just a glass of water, I'm running to the restroom. If I just like eat the simplest, just bland rice, I'm gone. I was sleeping all the time, and the worst part, unfortunately, which I actually commented on one of Sam's Instagram queries, was my girlfriend at that point was just putting me through such stress. My relationship was just so toxic and stressful, and the worst part was she wasn't letting me sleep when I was tired. She was forcing me to stay awake throughout the time, and she necessarily did not understand that I was going through hell. And unfortunately, that definitely didn't help with my Crohn's also. It just flared me up next, left, right, and center. And I just ended up, tell what I was telling you guys through COVID, through azathioprine, fistulas, and all of that. And unfortunately, I rediscovered I had stupid tuberculosis also. So I had to get tuberculosis treated also. So I'll go to the next one.
Yeah.
Yeah, so these are just the reports, and you can look at the colonoscopy report. My intestines does not look happy over there. Lots of ulcers and lots of erythema.
Yeah, I showed
Yeah.
one of the girls at work those photos on that one, and I was trying to explain to her about like how mine would compare to yours, especially on the top one. And I was trying to
Mm,
say what it should look like compared, and she was like, "Oh my god!" Like, because she doesn't obviously have IBD,
mm,
and it just sort of hits home that I don't think people quite realise that just because on the outside you might just look a little bit ill and a bit tired and a bit weak, what is actually going on internally, I guess.
no, it's a silent disability, right? People
Yeah.
don't realize all the pain and the restrictions that we actually go through because on the outside we look normal. It's just sad. We'll go to the next one. So yeah, this is the current year. So a lot of good news of this year, at least. It's very different news. I'm sure if anybody is still there, who's going to listen to this part of the stuff is going to be pretty surprised. So I had to take a leap of faith, and I definitely did a lot of research before getting into this. So currently, I'm under this treatment protocol under Ayurveda, which basically, when I so this takes place in a state called Kerala, and I'm from another state. So he asked me to come to the state, come to the place, stay there, and I stayed there for around uh, 18 days. And as I went there, I spoke to him for almost 2 hours throughout basically all the stuff I've been speaking to you guys about.
Yeah.
And he asked me whether I was tapering down my steroids. And luckily I was. And in their therapy, they have a pretty serious diet modification along with the medicines that they prescribe. And completely stopping all of the medicines that I was taking for my Crohn's, including the even the other alternative ones like cannabis also. So from the day I went there, the next day I had stopped taking my mesalamines, stopped taking my steroids. I stopped my CBD oil and probiotic pills, and I started following this diet to like the last point because if I was really giving an honest effort, I didn't want it to be half-assed. I didn't want to sneak in a biscuit here and there or do something, some other bullshit like that. I just wanted to make sure I follow it completely. And the diet is so simple, it's hard. Can you go to the next slide?
Yeah.
I'll just show them the diet and that.
Is it the one after this one? Because I've got a few
Yeah.
more. Yeah, do you want me to keep going?
No, this is the one.
Oh, okay, cool. Just checking.
Yeah, so this is the first colonoscopy report, and again, you can see that my intestines were definitely not a fan. A lot of ulcers, a lot of deformities. And this was, at this point, I kind of made my mind that, okay, I'm going to try something new. And whether it's going to help me or not, I'm not sure, but it definitely can't worsen my situation from what it already is at this point. So this is my prescription for the science-based evidence-based Ayurveda. So he prescribed me two medicines, as you can see, the Amrita Shradanga, which is 1/4 tablet every 2 hours throughout the day, and Shardarna, which is 1/8 tablet throughout the day every 2 hours. The major part would be from the last 4 points, which was you guys, Sam, you should read into this thing. It's called Giloy. Just
Okay.
read about its therapeutic benefits.
Okay.
I basically every day in the morning I have some of these Giloy stems that I peel and just kind of crush, put it in the water and heat it up, and that's like the only water I have throughout the day. And the food I have basically rice gruel, broken rice or brown rice, and this is basically the main source of my carbohydrates. And the other source of carbohydrates is dahlia, which is basically broken wheat. There's not one drop of oil, not any sort of other flavorings or whatever. The only thing I'm allowed to add is turmeric, salt, and black pepper. That's all. And I've been following this diet for almost the past 50 days. And also vegetables. I've been only eating boiled potatoes, boiled okra, boiled beans, pumpkin, and what's the other one? Wait, what's the other one? Potatoes, beans, okra, pumpkin, and and carrots. Yeah, carrots, boiled carrots. That's a pretty big one. That's where I get all of my beta carotene from. And the only source of protein I have is green gram, which is I don't know what it's called for you guys. It's green gram. What's it called?
What does it look like?
Mung bean. You know what mung bean is, right?
No, no. Mung bean. Yeah, yeah.
Yeah. So just mung beans, which are soaked in water. I just cook
Yeah,
them
yeah.
at.
We made to
I
grow
just
them
cook.
in science when we was kids.
Yeah, that's the stuff. That's the exact one. That's the exact one. So that's the one. So yeah, just I steep that in some water, let them sprout, cook it in, and that's only what I've had. And you know what, Sam?
Yeah,
Um, just for your general diet, even if you're not going to follow all of this also,
yeah,
and for everybody who's listening also, you guys should definitely include turmeric in your diet
yeah.
because curcumin has very good anti-inflammatory properties. My gastro itself prescribed curcumin tablets. It's super helpful. Just look it up. Um, you don't really have to buy the capsule forms. You can just get good organic turmeric powder and just add it to your cooking. Like Indians have been doing that for a very long time, and even without, I mean, now people actually bottling it up and selling it for like a couple of like 40 euros or whatever for like 20, 30 pills. We've been following that for a long time before it was like sort of mainstreamed or whatever.
Yeah,
Yeah,
it's got quite
it's
fashionable now, hasn't it? I think turmeric.
yeah, it's fashionable, but I would say go ahead because it's going to help you. Just add it in something, or just make some turmeric latte or some tea or whatever. Yeah, I mean, that's true. Turmeric does stain. It does stain, but it's okay. It's going to help your tummy, so it's fine. Uh, Sam, go to the other one, no? The
Do you need
next
me to
slide.
go back? Sorry.
No, this is the one.
Yeah,
That's the one. That's the
is it
one.
okay? I was sort of preempting when you'd asked me, and I didn't know if I'd done it too soon.
No, no, no. You're doing a super good job. So yeah, so this is basically. I don't know if they can really see the values,
Okay. No,
but
probably not.
um, in Feb of this year, my CRP levels were 21, and in March of 14, it was 15.1, and on what is it, 15th, that's 19. So that's 4 days of following this diet and that treatment. My CRP has effectively gone down 6 points, and that too, this is without any medicines, any anti-inflammatories, any steroids, none of that. Just the food I was eating, that Giloy water, and those two tablets that I break 8 times a day. And what is that? Another 4 days from that, the CRP drops another 2 points. And finally, 10 days from when I started this treatment, my CRP has come down from 15 to 3.1. And honestly, that has not even happened to me when I took my and like my immunomodulators also, it hasn't come down that fast. And I, it's almost insane or too good to believe that it reduced that much without
Yeah.
any sort of traditional, like any of those medicines. Just these 5 vegetables boiling, that one rice I kept boiling and eating for breakfast, lunch, and dinner. There has to be some sort of
Connection.
reality to
Yeah.
this also. It can't be complete bullshit. And especially coming from, like, I'm studying medicine where I'm supposed to prescribe all the stuff that's been prescribed to me. But when I see the other perspective and other side of it also, where, see, at the end of the day, I would say holistically, if it's helping somebody really cope up with their symptoms, cope up with their flares, and you should try to keep some level of open-mindedness to this too. But I'm not asking you guys to just go to some random Ayurvedic place or just, completely have no idea of how these things work. The reason why I actually went to these guys, honestly, they know medicine more than some of the people I go to. Like the level of knowledge on the pathology from the cause and the root of the disease is what actually made me go to them. I just didn't go to them because I just saw that, it's doing good, I'm going to go. But they are freaking knowledgeable. So that was the reason why I went and the reason why it came down so much also. But then unfortunately it goes back a little bit because I picked up an acute respiratory infection and they treated that also just through their Ayurvedic stuff and it comes down to 7.7. I'm going to the other one now. That's the last slide, I think.
Yeah.
Yeah, so this is basically the graph of how it just kind of progressively reduced my CRP on the first one. And the second one shows how my vitamin B12, and trust me, it sounds, the reason why I got my vitamin B12 done, throughout, I would say, since 10th grade, um, till even last year, my vitamin B12 has been shit. It's always been borderline or deficient, and I've always gotten my vitamin B12 injections done to a point where on my left deltoid, I have a hematoma because one jackass didn't do it properly, and it just sort of became its own entity. And even now, if you just sort of touch this place, there's like a slight bulge from the vitamin B12 injection. And without taking any of those injections, just eating those you know, vegetables, my vitamin B12 was 353, which is well above whatever it was before. And that's pretty surprising for me to like look from a medical perspective. And finally, this was just done like today's what, 29th? I think for me it's 29th, for you it's still 28th, I think, right? Is it 28th for you guys still?
I'm
28th
just,
April?
I'm trying to, oh, you on about that? I wonder what you was on about that. Yeah, it's still the 28th at the minute for us, yeah.
Yeah, so I'm technically from the future. So I got this thing
You
done
know, when you
2 days.
started to think like a bit like, you know, when you're getting a bit tired and then you're like, what? And then you're like, oh shit, yeah. It took me a few minutes to register on different times.
Time zones, yeah. So this was 2 days back, and it's 6.2. And effectively, the treatment I was on was to reduce my inflammation. And the treatment that I'm going to start from 2 days from now, from May 1st, the ghee treatment, is to stabilize my immune system, is to kind of reduce the increased hyperresponsiveness of my immune system. So I'll definitely keep you updated on that. But
Yeah, it's pretty cool.
basically, once that's over, that lasts for another 10 days. And in that 10 days, I can introduce the same food, but I can add some ghee to it. And 10 days after that, I can add some dairy products. And 10 days after that, maybe I can introduce some more food stuff. Finally, to a point where I can basically eat whatever I want without having to take any medicines. So that is like the next stage of this treatment. And what I was told is if there is ever a point where you do feel like, okay, your stomach is acting up, immediately switch over to this diet. Immediately switch over to these five boiled vegetables, to this boiled rice, the brown rice. Have that until your stomach goes back to normal, and then you're okay. So that's the next perspective or the next journey of my treatment, which I am really excited about because I'm kind of tired eating potatoes, carrots, beans, and pumpkin for the past 1.5 months. Honestly, it takes a lot of willpower to just
Yeah, I'm
continuously
not
eat that
surprised. Yeah, I can imagine. I really do feel for you. I
because
really
I
do.
eat all kind of shit, dude. I I eat every like stupid thing. I just made some pasta for my family yesterday, and I made some apple pies and some mango pie and some chicken,
And then
and I can't
can't
eat
eat
any of
it.
it.
Oh, that's just like, yeah, it's cruel.
And they feel sad also. They're like, "Why are you torturing us like this? Don't make anything. Make when you can eat." Like it's okay. I will live vicariously through all of you guys. Take my friend, take my friends out to a bar and they just get drunk and they're like,
Oh.
"Bro, please drink something." So I'm like, "No problem, man. You chill. I'll see you chill and I'll be happy."
Yeah, it's sort of one of those things that you could talk about on itself, like watching all your friends eat and do everything that you sort of can't do anyway, let alone on a strict diet. I think you've got one more of a little thank you message as well.
Yeah, that's also. Thank you for listening to me yap about this thing for like 2 hours, I think.
Yeah, it's so far it's our longest IBD stream actually, but obviously there's a lot of content to get through for people. And I think it's sort of worth obviously um I guess listening and finding out if it does sort of help for other people tuning in. And I know obviously it's longer, so I apologise because some people might have to go and have a wee or put the kids to bed or whatever. But on the whole, the stream stayed fairly consistent throughout with viewers. So I'm assuming there's a few of you still stuck around from the beginning. So for anyone who sat around from the beginning, thank you very much. I know Kitty apologised that she'd got to go because I do think some people have to be up for work and stuff like that as well. And obviously you're staying up extra late for us all, so it's even later where you are at the minute. So um, Obviously, if anyone wants to put in the stream any questions just to wrap it up, send them through now. Because we'll start obviously saying our goodbyes and everything. And if obviously you're here and you want to ask questions or say a nice thanks, I guess, because this is my first ever guest who's come so prepared with like a massive PowerPoint and everything and gone through a hell of a lot of information with people. Answered questions that, whilst most of us obviously can only speak from personal experience, we can't actually give like more of a medical opinion, I guess, on stuff. So I think that's probably been one of our most informative streams, and like I say, you've prepared so well, so thank you. And thank you so much for staying up late as well. I do really appreciate it. And I have put in the comments at some point that even if people have left early because of obviously having commitments, the stream will sit on Twitch for the next 14 days with the comments still in the chat, so people can still see it with the comments and just obviously can't interact live. But it will also then get screen recorded and then put onto YouTube. Usually, I make sure it's done probably a week. It never get lapses, so it'll be a week or two. I never know the exact date because I actually work very long hours, to be honest. Like, I'm self-employed usually during the day. So yeah, so this stream won't disappear. So even if you've got friends who are IBD sufferers who you think, oh, you know what, this stream is so good, let's tell them about it. The more people you share it with, the better, because the more people that know this stream's going on, the more people talk about it, the more you guys share and pass it on or follow or whatever, the more people that are going to get involved, because it really, really, really does need to be talked about. We don't need to be embarrassed. And like I say, considering I'm very new up to IBD, I guess, as like a community, everyone I've come across is so happy to share knowledge, even on like, oh, you want to be making sure you're taking vitamin D and everything like that. So, honestly, please, please, please do let all your friends know, and if you do want to watch it later, feel free. I haven't had any questions come in. We're just getting lots of thank yous. And like I say, thank you for staying up late and coming prepared. Yeah, I totally agree. The IBD communities are absolutely amazing to talk about your issue. Like, literally, you could go up to a friend and be like, someone you've never met but you talk to often. Oh, can I just send you a photo? Does this look normal? Is this normal? I know you mentioned earlier in the PowerPoint about, when you manipulate the stomach and you're listening for sounds. I was thinking that's something else I've noticed lately. My stomach's producing the weirdest noises ever. Almost like I can hear like air just moving round. And I realize, what the fuck's going on there? Like, I have it on and off during flare-ups where I feel a little bit of something, but lately I've noticed, I was sat in the bath before we come on the stream, and I don't know if it was because I'm hungry, because they're definitely not rumbling noises, they're definitely like
Yeah.
weird air noises. I'm like, what the fuck is this? If anyone sat listening to my belly right now, they'd be like, what the fuck's going on with you? Yeah, so if you guys don't want to ask a question, I'll just give it one more second, and if not, we're going to sign off. But thank you so much for sitting and listening for so long. I really do appreciate it.
Yeah, I also want to thank everybody, honestly. I
Yeah.
don't know how much of what I was saying kind of actually helped you
No, it's
guys,
perfect. Very, very
but it was
good.
really
Oh,
an honor.